Great. Okay. So good afternoon. Welcome to our webinar on the New York State Healthcare Worker Bonus Program. My name is Ed McWilliams. I'm joined with Ken Cerini. We are partners in the firm Cerini Associates, LLP. And we are here today to talk about this program, which was announced as part of the budget, but is now coming out with details earlier in August. And just as a general overview, this reminds us a lot of the early days of PPP and those programs, which we've all just recently finished living through, where there's a lot of questions and not as many answers as there are when it comes to all of these questions. So we are doing everything we can with all of the resources and information that we have. But like with those PPP things, there is new information coming out continually. So please make sure you are subscribed to our newsletters, to our mailing feed, so you get our continual information as these changes come through. And, you know, we bring up the PPP thing because, like I said, this is very familiar to that program in that it came out and we all immediately said, wow, we want to learn more about this. And as we started to really dig into the nuances of it, questions upon questions came up that we're just, not sure of. There's, a lot of, the analogy I use is there's a lot of games that we're all used to playing by certain rules with. And when these new games come out, maybe the rules that we're used to, don't always apply to them. But we're going to do our best here to try to provide an informative information session for everyone and try to answer as many questions as we can. This presentation and our other resources are available on our website, CeriniAssociates.com. This information and the webinar is for educational purposes only and cannot be used to contest any IRS, New York State, or any other penalties and assessments. The information that we are providing is based on our best understanding and knowledge as of August 17th, 2022. We know more information will be released on this program, and much like with that PPP, things can change from our original interpretations. But this is our best interpretation as everything happens right now, and we will make an effort to answer questions throughout the webinar and at the end, time permitting, and we thank you very much for all of that. All of that said, I'd like to introduce Ken Cerini, Managing Partner of Cerini Associates, to start talking about the program.
Thanks a lot, Ed. Welcome, everyone. This is, as Ed mentioned, that this is a fun program. There are going to be changes. There'll be clarifications. There's parts of the program that haven't been released yet. So anybody, and we'll talk about a little bit more, but anybody in the education world, the regulations aren't going to be coming out until October. So, there is still a lot that we don't know about this. We're going to work through as best we can with the answers that we can provide. There is a series of questions and answers, and we will provide you links to all of that. Understand that it's really important that you understand the rules and regulations with respect to this, because the Office of the Medicaid Inspector General is going to be coming in and doing audits of amounts that are being paid out under this program. If you don't get it right, which means if you pull down funds that you're not necessarily entitled to, or if you don't provide bonuses to staff that are entitled to bonuses, you could wind up with penalties. So this is something that we are going to have to really pay close attention to make sure we get it right. So as Ed mentioned, that this was part of the 2022-2023 New York State budget with an allotment of about $1.2 billion. It is located in Part ZZ of Chapter 56 of the laws of 2022, and it allows for the payment of bonuses to recruit, retain, and reward healthcare workers meeting certain eligibility requirements. This bonus program was put in place to kind of reward healthcare workers who were on the front line during the COVID pandemic, which actually is still going on, and have been there throughout and have been helping to make a difference. Only employees who are qualified employers are eligible for payment, and we'll talk about qualified employers in a little while. And it's only bonuses are only eligible only for eligible employees. And again, we'll give you a definition of what eligible employees are in a little while. Bonuses can be up to $3,000 employee. That's the maximum. And that $3,000 is across all employers. And the bonus is based upon hours worked. And that happens over a period of 5 vesting periods, which we'll talk about. And as Ed mentioned, the program is still new with many specific questions unanswered. So we will be pushing out more guidance as things progress. So do expect that there will be certain clarifications. And again, we will let you know when those clarifications come out. So in order to qualify as an employer, you have to have at least one employee. You have to bill services under the Medicaid state plan or under a home or community-based service plan waiver. Entities with a provider agreement to bill for Medicaid services through managed care or long-term care plan are eligible. And then, as I mentioned before, certain educational and other funded programs, which includes certain providers, facilities, pharmacies, school-based health centers, licensed under the state public health law, mental hygiene law, and educational law. And then programs funded by OMH, OASAS, Office for the Aging, and OPWDD. So again, if you are providing healthcare related services as an organization or as a company, if you are billing for Medicaid or you have Medicaid eligible services, there's a good chance that you're going to be a qualified employer. In terms of the qualified employers, Medicaid employers must be enrolled and payable through the eMedNY and have an active MMIS ID number. If you're not enrolled, you can go to eMedNY website to enroll. You can also call them if there's any problems with your MMIS ID so that you can submit, because you're going to need that information for the HWB program portal. If you are not non-Medicaid employer, you should use your SFS Vendor ID to submit on the HWB program portal. And then, as I said before, the program component with respect to the education, that's not going to be open until October, but it will be open according to the regulations for school districts, charter schools, non-public schools, approved preschool programs for students with disabilities, which is going to be your 4410, 853 programs, BOCES, private institutions of higher education, healthcare worker bonus pool. Like I said, it'll be open on October 1st. Who constitutes an eligible employee? An eligible employee is a frontline healthcare and mental health practitioner, technicians, assistants, and aides that provide hands-on healthcare service to individuals. When we talk about frontline healthcare, that includes organizations or employees that are providing face-to-face services. It also would include telehealth services. So as long as you're providing a direct service, you're included in that pot of eligible employees. You have to work for a qualified employer, which we just talked about in terms of what a qualified employer is. And you have to be under an eligible worker title. And we'll talk about those worker titles in the next couple slides. And then you have to meet certain additional criteria. So the first is you have to be continuously employed by an eligible employer during a vesting period. Now, there are 5 vesting periods. Each vesting period consists of a 6-month period of time. The first vesting period started October 1st of 2022 and went to March 31st of 2023. And then there are 4 more vesting periods past that, covering each of the next 6 months periods of time. So you have to continuously work during that 6-month period of time in order to be considered a qualified or eligible employee. Your base salary cannot be more than $125,000, and that excludes bonuses and any overtime pay. So that is the base compensation, can't be more than $125,000 to be eligible. Employees for the program include full-time employees, includes part-time employees, temporary workers, as well as independent contractors. And when we talk about independent contractors, we're talking about individuals that you contract directly with in terms of being independent contractors. So if they're coming through an agency, they would not be counted. So these are just going to be individuals that you're directly contracting with through providing services. So if you have a physical therapist or occupational therapist who you issue a 1099 to, but you're working directly with them or their company, then that would count.
And this is obviously a very slippery slope that New York State is going with down here, because the independent contractor versus employee question is always an interesting one, particularly for certain providers in certain areas. And this right here, and including them as employees, just remember, this is only for this program only. It's not going to change any other classifications, but this is definitely a slippery slope that New York State is going down with this definition.
Yeah, and when you read through the Q&A, the Q&A doesn't really talk a whole lot about the independent contractor component. So the regulations talk about independent contractor. The Q&A is kind of silent with respect to independent contractors. So again, we may see some clarification as we move forward with respect to this whole area surrounding independent contractors, but right now the regulations do talk about independent contractors as eligible employees. So again, when we talk about eligible worker titles, you can see it's a pretty big list here. These are what are considered your frontline direct healthcare and mental hygiene workers. So when we're looking at the list here, I'm not going to go through it in detail. This information is here. It's pretty much a lot of therapists, counselors, again, individuals who are providing direct services. That's what you're going to find on this list. You're going to notice for you education providers out there, teachers are not included on this list. And for those of you who follow and work with the consolidated fiscal report for New York State and filing a CFR, it's principally 300 level code staffing here. Not necessarily your 200 level staffing, but it's your 300 level staffing. So again, you should be taking a look at this list. You should really be gaining an understanding, because these are the employees that are going to be eligible in terms of the worker titles. If you happen to be with a hospital or other institution, which includes like an Article 28 clinic and stuff, you could also get coverage for support workers. So things like your maintenance staff and some of your clerks and your food nutrition workers and things like that in a institutional environment, those would be includable. And those, again, those institutional environments, they specifically mention hospital, skilled nursing facility would constitute an institutional medical setting. And in the Q&A, they do refer to Article 28. So there could be some clinics that kind of fall into this category too. So yeah, if you have any of those categories, you might be able to get some of your support staff covered. From a bonus requirement perspective, bonuses are calculated based upon the amount of hours an employee works. So if an employee works a total of between 20 to 30 hours during a particular vesting period, and that's average hours per week during that vesting period, they would be entitled to a $500 bonus. If they work between 30 and 35 hours average during the vesting period, they'd be entitled to a $1,000 bonus. And if an employee works at least 35 hours per week or 35 or more, they'd be entitled to a $1,500 bonus. According to the regulations, disability, Family Medical Leave Act, COVID leave, paid time off, all of those things are included in the average number of hours worked. So you'd have to calculate how many hours. So if someone's taking a week off and they typically work 35 hours, you would count 35 hours for that week that they took off. So it would follow what their normal work schedule would be. Qualified employee is eligible for up to 2 vesting periods per employer. So the maximum bonus that's out there is $3,000. That's the maximum you can get. So if someone works for you for the first 2 vesting periods and they work 35 hours, each of those on average, each of those 2 vesting periods, they will have gotten $3,000 and they'll be done. Even though there are 5 vesting periods, that employee will be completely done because they will have earned the maximum $3,000. You have an employee that works for you and maybe works for another agency down the road. And if you're paying them less than $3,000, that employee can get up to $3,000 across all employers. The employee is going to have to fill out an attestation form. that attestation form will provide you with substantiation or support that they have not yet received that $3,000 from all employers. You have 30 days to submit the claim from the end of the vesting period. As I mentioned, that first vesting period runs from October 1st of 2022 to March 31st of October 1st of 2021 to March 31st of 2022. So obviously that vesting period is already over. So to sit here and say you have to file it within 30 days of the end of the vesting period doesn't necessarily work. The regulations basically started the clock running for that vesting period on August 3rd. So basically you have till September 2nd to get this paperwork in for the first vesting period. Now I know that sounds completely unfair because you're in a situation where a lot of people are on vacation. But again, this first vesting period or the first submission is due by September 2nd of 2022. Hopefully we can get some level of extension on that because again, that is a tight time frame, especially since they're only doing, there's only education coming out on this tomorrow for anybody who's signed up for that. So again, there's a lot more questions than there are answers in this. So this is going to be difficult for providers. I think it's important for anything you do to make sure you're documenting what you're doing and making sure that you've got proper documentation of the decisions that you're making so that you can substantiate. As I mentioned, employees must complete an employee attestation form. It says here prior to the claim submission due date. The reason we put that in there is that's what the regulations imply, because the regulations do come out and state, and I'm going to read straight from the regulations. It says that qualified employees are required to employers, are required to claim the bonus on behalf of their employees. An employee is not able to claim the bonus independently. The following attestations will be required for a complete claim submission. So that wording implies that the attestation forms have to be submitted with the submission for the claim. Whether that's ultimately going to hold up or not until we get onto the system and we start putting in a claim, I don't know for sure. The attestation forms are available and we have a link to them later in the slides. But remember, this is the first claim is due by September 2nd. So you really have to start reaching out to your employees, eligible employees, and get them to start filling out these attestation forms. You have 30 days from the day you receive the funds from the state to pay your employees the bonus. So employees will be eligible for a bonus, again, if they work the full extent of a vesting period and they are still there by the time you're required to pay the bonus. So if an employee works the full vesting period, but leaves before the money is received from the state and it's distributed within that 30 days, they forfeit their right to the bonus. You're not allowed under the regulations to make an advance payment under the bonus system. So you can't turn around and say, I'm going to pay out my employees now and I'll wait till later when I file and get the money. The frequently asked questions specifically prohibits you from making any advance payments. If you have a former employee who did leave, they may be entitled to the bonus if they were there for the full vesting period. They were there for the 30 days past the vesting period where you were required to submit the paperwork. The monies came in and you didn't pay them within the 30 days that you were supposed to. And then they left on day 31, you would still owe them the bonus because they were there during the full term that they were supposed to. Correct.
This is a common question that's coming up, and one that I think the way New York State wrote it is confusing, but the way it is written says that if you receive the payment and don't pay within 30 days, you're required to pay a former employee. Otherwise, you're not required to pay a former employee, meaning that if you got money for them and they and you didn't pay it within 30 days of paying it, and they left afterwards, you're still required to pay them. That's the only time you're required to pay them.
And if an employee does leave, you have to return whatever funds that you did not pay out back to the state. So there is a requirement to refund the state for any payments that were not made. So let's talk about the vesting periods. So as I said, there are 5 vesting periods. The first vesting period goes from October 1st, 2021 to March 31st, 2022, as I mentioned before. The start date of the submission is August 3rd, and you have to have that in by September 2nd. Then we start getting to the normal cycle. So it goes April 1st to September 30th. You have the full month of October to get that claim in, and you can kind of see the dates when things are due. I know there have been some questions that have popped up asking about, well, when do we have to give employees a bonus? If they're eligible in vesting period 1 or 2, can we hold off, use other funds, and then maybe make them active in vesting period 3, 4, or 5? The implications are how it's laid out within both the Q&A and the regulations. It seems that as soon as an employee becomes eligible to receive the funds, and they've met the requirements within a vesting period, even if that vesting period they only worked part-time and in another vesting period they worked full-time, as soon as they are eligible, it seems that you have to start making the bonus payments to them. So if an employee worked on average 25 hours in vesting period 1 and vesting period 2, and they jumped to 35 hours in vesting period 3, they will have gotten $500 in vesting period 1 from you, $500 in vesting period 2. You've paid them over 2 vesting periods, you're done. You know, they would have to work for another employer in order to get the any additional dollars. At least that's how it reads within both the Q&A and the regulations. The statute doesn't necessarily provide guidance on how to calculate hours during the vesting period. Again, we're looking at it as average hours. And I think that if you can use average hours,
it does say average hours in the statute, so that you are required to calculate the average hours worked throughout the statute. That is said within there.
The statute uses the term work during the period. For employees that are paid on an hourly basis, that should be fairly easy because you should know how many hours they worked. For salary employees, you would have to look at what your salaried contract is. Are they working a 35-hour week, a 40-hour week, a 30-hour week, and that's what you would use. And as I said before, it explicitly states that family medical leave, any other paid time off, sick, vacation, all of that stuff should be credited towards hours worked. And then again, you know, when it comes to all of this, use your best judgment and document conclusions accordingly. You want to make sure that you've got good documentation, because as we'll talk about a little bit later, there is a chance that these payments are going to get audited. Ed, you want to bounce back in and talk a little bit about the taxation side of this, since you are the tax guy?
I unfortunately am the boring tax guy here with that, Ken. There's a bunch of stuff in the Q&A if you want to hop in there. I left some ones that are more your speed in there too. So originally when the program guidance first came out, there was no clarity as to the federal income tax taxation of these bonuses. There was kind of an unopened question. New York State did update their FAQ shortly thereafter, and they have confirmed, which matches the research that we did, that these bonuses are considered to be compensation for federal income tax purposes and will be considered supplemental wages for employees. Therefore, they are required to be included on Form W-2 for employees. This now kind of begs the question about withholding, which I've seen a couple times come up in the question in the Q&A. So for federal tax purposes, you definitely need to have your Social Security and Medicare tax withholding, and then you would treat it as a supplemental wage payment, which under IRS Publication 15 means you can withhold for federal tax purposes one of 2 ways. You can either withhold at a flat 22%, or you can include it as part of a calculation with concurrently paid wages. I think typically speaking, most supplemental wage payments are done at the 22% flat number. That is typically how payroll processors set these up, and probably the easiest way to go through that. Currently, New York State has indicated these payments are not subject to state and local taxes, which now begs two questions immediately that I think continually are popping up. Number one is, how exactly would we report this when we do these payments? My feeling, and again, this is just my feeling, and there's a bit of conjecture here based off experience with other programs, is that I would treat these as exempt from New York State and New York City withholdings, because we know they're not going to be subject to tax. And I would work with my payroll processor to set up that code for the payment to be exempt from tax. And similarly, I would anticipate that the W-2s for employees will have a code in box 14 that indicates these wages. Again, they haven't given any specific guidance, New York State Department of Tax and Finance included, as to how they want to report these. But New York State has a program called Startup New York, which allows eligible employers that are within the program to have their employees not pay state income tax on those wages. And the way that is reported is it's not showing up as New York State wages in the W-2. There's no withholding on it, and it shows up in box 14 as Startup New York. So using that as kind of my guideline here, that's where I think the reporting of it goes. Employers will be responsible for their share of employer Social Security, Medicare, and unemployment tax on these payments. So a question that's popped up a few times in the fringes now has been questions about the mandated benefits and or this cost, which as of this point in time, based on the guidance in the program, is going to be an employer out-of-pocket cost. So figure if you have an employee getting a $3,000 bonus, you can anticipate a probably, somewhere in the neighborhood of $300 additional cost per employee that is not covered as part of this bonus payment. Additionally, these payments, subject to your 401k plan document, likely will be considered 401k eligible wages and therefore subject to 401k withholding for elective deferrals for employees and any 401k match. Now, your 401k plan document may have certain definitions that can exclude this, but generally speaking, I would anticipate that these are going to be considered 401k eligible wages too. There is the New York State FAQ does discuss that this should be paid on a W-2 as wages. Ken and I were having a conversation this morning about that, because I feel still that even if you are collecting for a contractor, I would not change my payment method relative to them, meaning if they were a 1099 prior, they're always a 1099 now, and that could be still allowable as paid on 1099. Absent a specific guidance, that is the route that I would go. But that is, as we kind of said, we're still interpreting a lot of tea leaves here with this. So now let's kind of talk about the tasks that an employer is going to have to undertake here. So the first step, number one, and I would think the majority of the 300 plus of you that are on right now is, are you a qualified employer? Meaning, do you have at least one employee and qualify under one of the Medicaid or similar billings that are there? If you are a qualified employer, then you're going to have to deal with this program. The next step I would recommend is you should identify the eligible workers based on the title criteria. Earlier in here and within the links in this slide deck, which we have sent out and is available on our website, there would be that list that New York State gave us of the eligible titles that they are allowing. So I would look at my employees, looking at their base pay, their work periods, and their title criteria to see if they are eligible. I would collate the data of total hours worked and the weeks in the period so I can calculate the average hours per week, what their base pay is based off of any employment offering document or similar, and you're going to need certain employee demographic data, address, social security number, title, date of birth, date of hire, which is all information that is requested on the New York State provided spreadsheet on the portal website. You will then need to register with the Healthcare Worker Bonus Portal, which is a link that we have provided within here. You'll need to gather your employee attestations and prepare your employer attestations and upload the data to the healthcare worker bonus portal. Afterwards, you will receive a payment, which will have a notation within the ACH from Medicaid, which says it was for this payment, and you will need to pay the bonuses within 30 days of receipt of the funds.
So let's talk a little bit about the audits and penalties. As I said before, these the funding, according to the regulations, are subject to audit by the Office of the Medicaid Inspector General, and they claim that they will be reviewing the payments released by eMedNY. So understand that there will be a certain number of providers that do get audited through this process. And the OMIG is going to be looking at this pretty closely. From a penalty perspective, as I mentioned before, you got to get this right, because if you don't get it right, either way, you don't give bonuses that you should be giving, or you give the wrong amount of bonuses, or you give bonuses to the wrong people. Any of those things, you're going to be subject to penalty if your calculations are off by more than 10%. And those penalties are up to $1,000 per violation. How they're going to define a violation is not clear. A violation could be per individual that you got wrong. It could be per incident. I don't know. I don't know how violation is defined, and nowhere in the regulations do they define the word violation, but just understand that the penalties could be steep if it's per individual. So let's say you have 50 employees and you decided not to tap into this program. You could be fined, you know, if the violation is per employee, you could be fined $50,000. So it could be pretty steep. So again, we'll keep you informed as new information comes out with respect to that, but something to keep an eye on.
As Ken and I were working through these and brainstorming kind of, you know, in so many words, how we would do this if we needed to deal with this directly, you know, rather than as a client support role, some best practices that maybe we thought about could be helpful here. So I would, at this point in time, given all the uncertainties that exist, keep all or as much contemporaneous documentation as you can for any areas of uncertainty, document any judgments made and calculations performed. I think given the rapid turnaround from regulation to submission to payment and the clearly many unanswered questions as the question number just keeps going higher and higher, there's a lot of things we don't know right now, and we're going to have to make judgments accordingly, and we have to use our best judgment. And I would document that accordingly. And when I think about best judgment, I say to myself, what was the program trying to do? What is the goal of this program? And the goal of the program was to recruit, retain, and reward healthcare workers meeting certain eligibility requirements for certain workers that provide hands-on assistance with health services, i.e. clinical, or care services, non-clinical. They have to be frontline. They must provide or directly support the provision of health care or care services to patients in certain settings and work under one of the titles listed. So that's what the goal is here when it comes to the program itself. I would recommend that employers track the efforts to get employee attestations, because as any employer on here can probably attest to themselves, getting employees to fill out and return things is going to be somewhat of a struggle. So I would make sure that I have some sort of documentable trail that shows I have attempted to get the attestation, how many times I attempted to get the attestation, and let the employee know that if they do not return within the time frame, they will not be getting such item, to basically provide coverage in the event, you know, someone comes and looks and says, why wasn't this employee paid a bonus? I would equally try to develop my own documentation as appropriate, from employees of how much in bonuses they may have received from other employees via a separate attestation. Meaning, we don't know for certain who is going to be policing the $3,000 overall limit that exists here if they work for multiple agencies or programs. So I would want to make sure that I'm at least trying to do my due diligence accordingly, and I have documentation of my due diligence accordingly. And I also think I would pay the bonus in a completely separate payroll outside of my normal practice. So I have a clear trail of payment, and where applicable, I would use a separate payroll code with my provider to allow this to show up on the pay stub as the healthcare worker bonus, and to overall just keep it as separate and clean as possible in the event someone wants to take a look at all of that and audit the program. So that said, Ken, want to unmute yourself here? I think we'll just probably take some turns trying to work through the Q&A out loud. As
I'm going to just rifle through some of the questions. Some of them I answered, but some of them I thought they were repetitive, so I thought it would be better to just kind of answer it. So somebody had asked about if they have a 4410 program, how does that work with respect to that first application period? If you're 4410, if you're an educational organization, if you're a charter school, any of the things that fall into that, I don't think you have to worry about anything until October 1st when the regulations come out. There's still a lot that needs to be kind of settled with respect to that. Things like, and I know one of the other questions somebody asked is, well, what about summer? What happens if I have a school and during the summer months people aren't working because we only have a 10-month school year? What happens during those 2 months summer? Again, it's a good question. It's a question I asked also. Not sure what the answer of that's going to be, and hopefully that'll come out during that October regulations in terms of trying to figure that out.
And I would think too that given the traditional period that falls under, where teachers traditionally may not be working, I would say that probably falls under continuous, kind of based on the other case law and other areas that potentially exists within that area.
EI providers, they are Medicaid billers, so EI providers would be eligible for this program, and you should be looking to do that. Again, the fun part there is some EI providers might be utilizing educational staff. And when you look at the list of eligible employee titles, teachers, teacher assistants are not included on that list of eligible employees at this point. I don't know if that's going to change when the regulations come out in October and something happens there. But at this point, working off that September 2nd deadline, you're in a situation where the position title code is not an allowable position title code, so you would exclude those employees. You don't really have a choice.
There's a lot of questions about staffing and temporary employees, and the FAQ indicates as such that if they have a supplemental staffing agency who is considered the employer, with respect who is considered to be the employer, and it says employers should only submit claims for bonuses for individuals they employ directly. If employed or contracted by a staffing agency or other intermediary entity, contracted and temporary staff are not eligible for this program. So that's directly from the New York State FAQ when it comes to that, which I guess is about as clear as mud for people that use this program, understandably, but that's the answer that we're getting right now.
Somebody also asked about multiple entities and stuff. And within the FAQs, the response was, the question was, I'm an employer with multiple MMIS IDs, or if I have a MMIS and SFS Vendor ID, so I could have multiple there. What do I do in terms of applying for the healthcare worker bonus? And the answer was, you can link the MMIS IDs to a user account. The broader then can link other associated MMIS IDs to that user account. So you're basically utilizing one user account for all of the entities that you're working with. So that's how you should look to do this. And then one other quick response, somebody said that they have certain, they provide certain services to agencies that bill OPWDD directly, and does that qualify for them? And I think the answer there is it's going to be the agency that bills OPWDD that's going to have the ability to, to provide those services. I'm not sure that you're going to qualify. We'd have to actually get a better understanding of what it is you're doing and how that fits, whether you have a MMIS ID or whether you you have your SFS. So you have to look to see where you fit on the realm there in order to determine whether you qualify. So I think that one is going to be more of a let's look at the facts and circumstances to really make a decision there, and it's not something that can be easily answered on something like this.
A couple tax questions that are just popping around here that are kind of frequent, so I'll try to address. Yes, the payments are subject to withholding. They are subject to Social Security and Medicare. And at this point in time, there is no indication that New York State will be reimbursing for the out-of-pocket mandated fringe costs, which will make the employer out of pocket on those costs. Similarly, if a staff lives outside of New York, i.e. New Jersey or Connecticut, this would work the same way that their regular wages work, meaning that it's considered to be New York source and you would treat it as such accordingly. You would not normally be withholding New Jersey or Connecticut wages on that because they're working in New York. The program has to be for people that work in New York.
When you're looking at the employee titles, those employee job titles were pulled directly from the Bureau of Labor Statistics. So if you go to the Q&A, they give you a link to the detailed Bureau of Labor Statistic descriptions. If your staff fall into, just because you have different titles, but if their job descriptions fall into one of the categories that are there, again, I would rely upon the Bureau of Labor Statistics for the for really gaining an understanding of what the job description is, and then document effectively that you relied upon this and how you got to the answer. But yes, it is possible that you will have eligible employees where their title is a little different, but their job description matches out to what's on the Bureau of Labor Statistics.
And just when you're filling out the New York State, they have an Excel spreadsheet on the healthcare worker bonus portal that actually limits you to only certain titles within there. In the event you have something like that, I would definitely choose whatever is the most appropriate title relative to their job duties as it comes to that, if you determine that they are eligible.
So there was a question here where someone said, did I just say that the 200 level codes aren't included? There might be some, and I apologize for misspeaking, there might be some 200 level codes that are. Most of the codes that are going to be allowable are 300 level codes, but there might be some 200 level codes that are allowable. Again, go back and look at the job descriptions and see that those fit in. So you do have some direct service provider, and habilitation specialists and stuff that might fit. How do you know if an employee has more than one employer? The employee is going to provide you with an attestation form, and that attestation form is going to they're supposed to be notifying you if they've made him.
The attestation form does not state anything about multiple employers with on there. That's why I'm saying, as a best practice, I would develop my own attestation additional supplement for my records, asking if they have received additional bonuses and or have additional employers for my own purpose here, because that is not covered on the employee attestation. The employee attestation is actually pretty straightforward.
Somebody had asked about if somebody resigns subsequent to the vesting period. I think we covered that. So if someone resigns subsequent to the vesting period, but before you receive the money from the state and distributed the money, they're not entitled to it. Unless you distributed it late.
Correct. Only if you distributed it late.
An employee is only entitled to 2 vesting periods from an employer, and that is it. So if someone gets 2 vesting periods, leaves and comes back, they're still only entitled to the 2 vesting periods.
And if they move to a separate employer, it's 6 across all employers, but 2 for any given employer is how it works.
It's 5. There are 5 vesting periods.
5. Okay, I thought it was 6.
I don't know whether teachers will be eligible in the future. Again, that's a question for a later day. But right now, if you look at the list, teachers are not included. In terms of a formula for average hours, there's no formal formula that's spelled out within the instructions. I think it really just looks at how many hours did the employee, and I'm going to use the word worked, but it's not necessarily worked because it's paid time off, family medical leave act, sick, anything else. So how many hours did the employee get, in essence, paid for, divided by the number of weeks in the vesting period to determine what the average hours are.
Right, and just on the former employee question, just so we can, have it here. This is the exact quote from New York State's FAQ on this. They are obligated to pay former employees that are eligible and vested while in their employment, provided that the employee did not terminate his or her employment with the employer prior to the due date of the bonus. Meaning that if they terminated their employment with the employer prior to the due date of the bonus, you are not required to pay them. In other words, if the employer fails to pay the bonus within 30 days of the receipt, the employee may leave, but the employer will still be obligated to pay the bonus. So they had to be employed by the due date of the payment to get this bonus. It's a handcuff like that in that manner.
And are you looking at this vesting period as cash basis or accrual basis?
They say it as worked. I think any reasonable metric and measurement will probably be acceptable when it comes to that. I don't think they're going to, again, my feeling is based on all of this, they're not looking to split hairs on that particular item. Given my druthers, I would say it would be the actual days worked, but I would, I think if you did it on actual days paid, I don't think they would necessarily give you a difficult time with that.
Someone asked about an Article 16 support staff. Again, within the frequently asked questions, they do mention Article 28. There is discussion regarding mental hygiene, which is Article 31. So again, I think it comes down to looking at the whether or not you are considered a kind of an institution, because within the frequently asked questions, it says, all other healthcare support workers refers to workers that support the provision of healthcare services to patients in frontline settings for these titles. Such workers must support the provision of patient-facing care provided within a patient care unit of a hospital or other institutional medical setting in support of treating and caring for patients. So again, you have to look at, and within the chart, it says all of the patient-facing care support workers in Article 28 facilities. So, they do specifically talk about clinics in Article 28s. So again, the answer is a definite maybe. I'm not 100% sure. But again, if you can show that you're institutional medical setting, I think you're good.
There's been some questions about correcting errors after you made the initial claim. I don't think they've given, I know that I can think they haven't given any guidance to that yet. So I cannot tell you if there is a mechanism to correct or not correct that. I wish I had an answer to that one, but that one is definitely a question that is unanswered.
Someone asked about OPWDD, maintenance staff, quality assurance, all those other staff. I don't know that OPWDD program would qualify as an institutional medical setting. So I think you're hard pressed on the OPWDD front to get in the other healthcare support workers. I think you really just have the frontline workers for OPWDD. Are contracts with DOH and Westchester County OMH and OASAS included? I would say most likely yes. OMH and OASAS are providers that do fall under the category and are specifically mentioned within the regulations. If an employee does work for another eligible employer, how will we know if they receive minimum allowed bonus? We talked about that, and Ed had mentioned that it's important to try to get them to provide some level of certification. School districts, there's nothing you can do at this point. You have to wait until October 1st. When those regulations come out, we may try to do another one of these to kind of fill in the education world as to what's going on. I think I answered this question, but if an employee qualified and received $500 bonuses for 2 vesting periods, then went on to full-time, are they eligible for the differential? The answer is no. My understanding from the regulations is once you've gotten paid through 2 vesting periods, that's it, you're done.
Correct. One of the questions that I've been seeing pop up has to do with employees that start during the vesting period. the FAQ says they have to be employed for the duration of the vesting period. So I would say if they're not employed throughout the entire duration of it, then they would not be eligible based on the current read right now. I have a sense they will probably make some clearer guidance on that at some point in the future, but I can't guarantee it.
Someone had asked a question and mentioned a $300 bonus. There is no $300 bonus. It's either $500, $1,000, or $1,500, depending on how many hours you work during a vesting period, average hours worked during the vesting period. And you're entitled to a bonus for up to 2 vesting periods, and that is it. So it's not all 5, as we've said, it's only 2 vesting periods and you're done. You can, if an employee, works for multiple entities, it is possible they can get it in other vesting periods for another employer. But the maximum an employee can get is $3,000.
There's a question about, do job titles alone define which employees are eligible regardless of funding stream? And an employee is eligible so long as they meet the criteria within the program, meaning they are in an eligible title, they make less than 125,000, and the other 3 criteria, which are a little less relevant that we didn't really cover here. But so long as they are under those things and under those titles, they are eligible for the program regardless of funding stream.
The first vesting period is from October 1st, 2021 through March 31st, 2022. And there is a chart within the handout that shows all of the vesting periods. If an employer does not receive an attestation form from an eligible employee in time, and they do not submit the claim, can they subsequently submit a claim for that period?
I think that's a great question. I was actually typing the answer to that one, and I said I definitely might want to address. It poses a very, very interesting question that I think is unanswered on that one. I don't know if you have any thoughts on that.
There's nothing within the regulations either way. I think that's one that's going to need some additional clarification. You know, you theoretically have 30 days to submit. If you don't submit within that 30 days, I don't even know if they're going to allow you to submit past that 30-day period.
It also gives you the opportunity to have employees pick and choose what vesting period they want to go into, right? And I wonder if there's, you know, if they're intending this to be use it or lose it or not, because I think that's the question that I thought was fascinating. There is hey, an employee can go, I know I'm going to work more in vesting period 2 or 3 than I am in 1, so let me not give you the attestation so I can, you know, maximize in the 2 periods I'm going to claim. I don't think they necessarily have thought about that yet, but I think that's a fascinating question. All we know is that you need the attestation to submit for the claim.
As I mentioned earlier, I do not believe that OPWDD funded programs are meet the criteria for the institutional space. So I'm not sure that 500 level codes or program admin staff would qualify there.
And one thing that we didn't address on here, but it's been a common question that's coming up, and one that is relatively unanswered, but I think based on the way the tea leaves are reading right now, is you have people that work for multiple programs under common ownership or similar of that. And everything that we read basically makes it seem like this is on a per employer basis, meaning if you have an employee that works 10 hours for 3 separate entities, which is 30 combined hours, is only 10 hours per entity though. Based on the way that we're reading it and kind of the way the program seems to be reading on a per employer basis, they wouldn't meet the 20-hour criteria anywhere. Now, one of the FAQs does talk about linking together the
MMIS.
Yeah, the ID numbers under one login, and Ken and I were having a conversation about that before. I don't think that necessarily implies that you can combine multiple employers that have a shared service. I think that's just a item to prevent someone from having to create multiple logins for different employers. That it's just a convenience factor for the technology rather than a allowable idea of combining people under shared companies.
As Ed mentioned earlier when he was talking about the taxes, these bonuses are subject to federal tax. They are subject to Social Security. So when you're paying out the bonuses, you do need to withhold those taxes, and you should be working with your payroll company with respect to the New York State exemption.
And if someone is domiciled outside of New York, it is likely their resident state will tax them on this. Yes, that is correct. So New York has said it's not taxable for New York. However, New York has no other state necessarily has given any guidance on that. And I cannot really imagine that they're going to say, no, you're not going to be taxed on this, since they normally base it off of federal wages.
Someone asked a question about where do we get information that's being released tomorrow. I'm not sure that there's any new information being released tomorrow. Tomorrow they're going to be doing, the state is actually doing a webinar on this. That webinar is completely full. They will be distributing out the video of that webinar after it's over, so you can get a copy of that. We will try to also get a copy. We're going to be attending that. We'll also try to get a copy of that and make that available through our website. And if anything new comes out of that that we didn't talk about today, or if anything changes, we will be pushing that information out to everybody. It says, is the employer attestation submitted on the portal as part of the overall bonus submission? Again, based upon what we're reading in the regulations, it implies that both the employee and the employer attestations do get included with the submission. But until somebody goes on and actually tries to do one of these submissions, we won't know. So right now, assume that you're going to need the employer and employee attestations, because again, that's what the regulations state. But it may be different once you go to try to submit. For vesting period, should providers calculate by relative pay period or by actual vesting dates? I think you got to follow the, as Ed mentioned earlier, I think you got to follow the vesting periods that are there. And if you could either do it on a paid basis or accrual basis. I don't know, it's not clear from the instructions, but I think as long as you are consistent in how you're treating things, remember it's working off average number of employees, and it's working off that $126,000 salary basis. So as long as you're consistent in your treatment, I think you're fine. And someone asked, do we have to follow the vesting periods in sequence? I think the answer is yes. The regulations basically say when someone is eligible, you're supposed to pay them out the bonus. So I don't think you can pick and choose which vesting period you want to deal with. I think you actually have to work your way from the beginning vesting period straight through.
As I stated at the onset of this, there's a lot we don't know about this yet. And, I wish that Ken and I could give you all of the answers. I wish we had all the answers, because that would make us the smartest guys, but unfortunately we don't. We're really trying here to give our best interpretations of everything we have right now. And as more information comes out, please make sure that you are subscribed to our stuff. We will be sending out as much as we can, as often as we can. And then for these decisions that need to be made, we'll have to start working through on a case-by-case basis, because those are determinations that you as a provider are going to need to make and stand by.
So someone actually gave us a little bit of clarification here. So thank you, Diane. She said the portal does not have a place for adding the employee attestation. And I believe the training video says to just keep it on file. So it may be that the employee attestation is not required. You still have to get them. You still should have them on hand. But apparently it looks like you don't have to send them in with the application.
Yeah, I've seen that, but I remember reading somewhere else too that was there. So I was very surprised by that.
And then somebody incredulously asked, do we need to have this in by September 2nd? And the answer is yes. I know that's right around the corner, and I know a lot of people are on vacation, but yes, the first vesting period is due by September 2nd.
And then there's a question about a separate employee attestation for each vesting period. Yes, because they, if you look at the attestation form, it looks like a Scantron where it has bubbles where it says what attestation is there, and that the employee attests that they worked these during this period.
All right, I think we're basically out of time. Again, if we didn't answer your question, I apologize. We tried to do as many of them as we can. I think we got through about half of the questions that were there. If anybody does want to send questions, we'll be more than happy to try to answer as many of them as we can. But again, as Ed mentioned, the information right now is as good as the information we have right now.
And that's it. Thank everybody for attending. We really do appreciate you hopping on here. Hopefully this helped eliminate some of the stress with this program that everybody's going with right now. And hopefully
or maybe it added additional stress.
Yeah, that or, I have one client who was unaware this program even existed until yesterday. And he was like, oh, wow, thank you very much. So we'll see what happens.
Thank you, everybody. We appreciate your time, and hopefully we'll be getting you out some more information, and we'll be able to clarify some more over the next few days. So,
yep.
Thanks everyone. Take care.